Thank you. So welcome back, everyone, and I hope you did. It looks like everybody enjoyed the break. Had an opportunity to connect with others. That's fantastic. So what I'd like to do now is welcome Dylan George to the stage to give you an overview of the Center for Forecasting and Outbreak Analytics. Dylan is the director of the Center for Forecasting and Outbreak Analytics at CDC, where he and his team are focused on building world-class data and analytics capabilities to guide interventions in public health emergencies and pandemics. Welcome, Dylan.
It is an absolute pleasure to be with you all today. As is mentioned, my name is Dylan George. I am the director of the Center for Forecasting and Outbreak Analytics. We are one of the newest centers within the CDC, along with the Office of Public Health Data Surveillance and Technology. And we are, our main mission, there we go, is to try to use data as a superpower to kind of help in public health emergencies. So if we were actually to think back to the turn of the century in 1900, Galveston, Texas, actually there was a time where we didn't have weather forecasting. We weren't able to actually notify people about severe weather events. In 1900, in the fall of 1900, a Category 4 hurricane landed right on top of Galveston, Texas. There was somewhere between 6,000 to 12,000 people died that day because it crashed right on top of Galveston, because we did not have the data systems, we did not have the analytical systems, we did not have the systems to inform the people to get out of the way. That was the reason why we had this massive tragedy. It was one of the worst natural disasters, notwithstanding what's recently happened in Hawaii, going forward in terms of loss of life from a severe weather event. Now, that doesn't mean that we don't have severe weather events now. That doesn't mean that we don't have loss of life from severe weather events now. But what we learned from that day is that we need systems to help us understand, to analyze, and to inform people so that they can be safe from these events. So what we did from there is we actually developed systems within the United States to actually anticipate, to develop the data, develop the analytics, and develop the systems to do this going forward. So today we have the Hurricane Weather Forecasting Service that allows us to actually know where landfall is going to happen for a hurricane. We don't ask academics to stop what they're doing in their day job to help us understand where landfall is going to happen for a hurricane. We have people that are dedicated to this so that we can know how to actually pre-position resources to get people out of the way and to actually move things forward. Therefore, we don't have the significant loss of life like we did that tragic day in 1900 in Galveston, Texas. We have been able to put forward systems that have helped us actually do this. And we've used data to help keep Americans safe from severe weather. Now, within the Center for Forecasting and Outbreak Analytics, we are trying to do the same thing using analytics to help us actually keep Americans safe from infectious disease and public health emergencies. Now, this is our mission. We are very focused on response-related efforts to try to actually use world-class analytics to help us understand how to actually keep Americans safe. We're doing this, there's 4 main objectives of how we're trying to think about this. We refer to as predict, inform, innovate, and advance. And so for some of you probably have seen previous discussions on this. It's like we have a new one on the end right there. Predict is we're trying to build the teams and the tools, partnerships to actually generate the forecasting and the analytical results to give the evidence base that will enable people, communities, to actually choose what to do and how to keep themselves safe in the face of public health emergency. Inform is how do we translate that information to decision makers in a much more effective way. I had the great privilege of actually working with Hillary Godwin on a committee, an external advisory committee for the former mayor Jenny Durkin here in Seattle that did exactly that. And this is one of the reasons, because of that experience that was here in Seattle, that we've actually included that component into our structure. So what you have done here in Seattle is really informing us at the national level. Innovate is that we need to get much better at what we're doing, and both in terms of how we use analytics, how we collect data, how we actually visualize data, and actually how we inform on. So we're going to be spending R&D dollars on improving that going forward. And then also, this is the advanced objective too, is that we want to be a world-class organization. A really long-time colleague of mine has become the head of the UK Health Security Agency's sister organization that's very similar to what we're doing in the Center for Forecasting and Outbreak Analytics. And so I like to put this last one on there to tell them that we're coming after them, because they're the world best right now, and it's like we're gonna overtake them right now. So just a little bit more and predict. Like I said, we are developing the tools, the partnerships, and the team to generate the analytical results. We're going to be focusing on a couple key minimum viable sorts of opportunities right now. It's like we're going to be focusing on nowcasting, forecasting, scenario models, and then these kind of like question X general kinds of analytical capabilities that you need to answer. For example, just recently, the director of the CDC came to us and asked us, it's like, how can we understand what was going to be the impact of immunization on the various 3 sorts of respiratory diseases that we're going to be confronting in the next handful of weeks to months as we go into the fall season, RSV, flu, and COVID. What are the levels of immunization that we should be targeting going forward? So we put together some analytical results to help her think through what would be necessary for targets in that space. But these are going to be the minimum viable sorts of products that we're going to be developing, and the analytical kind of like SWAT team that's going to be putting forward in that space. I'm going to skip over that one, but there's other efforts that we have put into place as well to generate very practical decision support products, trying to get information out much more quickly. There's 2 examples of this. During MPOX, we put out risk assessments that actually condense down the data and condense down the analytical results much more quickly and much more efficiently, so that we could actually get that out to the community in an expedited way. And then we also did this thing, again, learning from what the UK Health Security Agency was doing, put out technical reports on what was happening in MPOX as well. We cranked through this on every 4 weeks. We were putting out new information as to what was happening at a national level, and then we were actually able to think about it from a state level as well. And one of the things that was a big contribution was the famed RT assessment. And so it's this is the metric of telling you, it's like, is the outbreak increasing, holding steady, or decreasing? And using data to actually kind of help calibrate on that. We were doing that at the national level and then also at the state level. And it allowed us to actually engage with a couple different states in different ways, assessing those capabilities. But we put these out in different ways. And also, if you type in right now, CDC COVID forecast, you will see a figure come up, a website and a figure come up like this. We now are generating these on an ongoing basis, week on week. You will see these results coming out forward. We've taken over those responsibilities to do that going forward. The thing that's really interesting that people don't fully appreciate, though, is that these results are results that are being generated by academic communities and private sector groups that are submitting those to the CDC, and then we ensemble them together and then we put them out in a systematic way. Because of the Center for Forecasting and Outbreak Analytics is now here, now we have a team that is on the ground and that we're building capabilities from there as well, is we actually are able to generate those within CDC as well. So no longer are we have to beg, borrow, and steal academics to help us out do this. We still want that because they're improving the way we do things, but we're also generating them internally as well. So from the innovate perspective, like I said, it's like we want to think about how are we innovating on both the technology and then also on the analytical methods. We need to think about how do we actually generate new methods, how do we think about new and novel data sources. For example, there's lots of promise associated with wastewater data, but how do we actually know how to use that wastewater data and what are situations where we can't use it effectively? The folks in Arizona used it beautifully to understand how at various levels in dorms on university campuses, there was actually people were popping positive. They had the system that could actually allow them to do that, and then they were able to move those students over into quarantine dorms and that sort of thing, so it was really effective. But in polio in New York City, it was very hard to interpret the wastewater data in terms of when you were seeing some cases pop in counties nearby. We need to really pressure test those, and we're working very closely with our colleagues on thinking through those. Ann Zink actually was one of the people that pointed out to me as well that it's like Alaska is 70% on septic. So it's like wastewater will be not as valuable in that setting as it will be in other settings as well. And so we just need to know what is the range. And so we're going to be innovating on the methodology and the data sources to move forward, but also on how we actually visualize data. You know, it's like if you look at Financial Times, the New York Times, handful of these other, they have amazing graphics that they put together, not only for COVID, but for a range of things. There's a lot of science that goes into how to actually develop those and what's really effective communication and what's just too much cognitive burden going forward. I will tell you, it's like as an academic and as a modeler, where I was trained as a modeler, we spent no time thinking about how to do visualization. It was like you can put a graph together and it was very quickly. It's like it makes sense to me, so I'm going to put it forward. It doesn't mean that that actual graph or that figure is going to actually communicate what you think it's communicating going forward. So we're going to spend some time on that as well. And then has been pointed out by a couple of my colleagues already, the technology that we're using is moving forward at light speed. And we need to think about how to actually push forward capabilities to actually make sure that we're at the forefront of using technology to actually generate these. And so we are keenly interested in things like machine learning operations, on how you actually can specify what are the kinds of workflows that are being used for generating the different modeling results so that we can actually understand if we make a change in the computational power and the modeling in the data or other aspects, what that result will be and how we can actually iterate it in an operational sense. One, so that we can improve upon it for ourselves, but also so that we can lay it bare to everybody else and we can crowdsource responses and make sure that other people can adopt those things going forward. And so we're very excited about those particular efforts. Our Innovate team is going to be focusing on those bits. Now, one of the things that I'm super excited about, you know, it's like, as we've all pointed out in a couple different ways, using data, modeling is really hard in public health. Modeling is really challenging. The data are siloed. It's challenging to work together. Cloud computing capabilities are scarce or expensive. We are developing a tool that is going to try to help address a handful of these things, and we call it the Virtual Analyst Platform. The objective here is we want to try to build a cloud-enabled environment that will allow us to be able to provide access to a standard suite of modeling capabilities that will allow people to actually do forecasting, do a range of different other efforts. Not only do we want to do this, we have this in prototype already. We have it on the CDC cloud and we're developing it right now. We have used this to help our team work effectively together. We have used this platform in pilot format as well to allow our colleagues at the Administration for Strategic Preparedness and Response to run their COVID scenario models, which they were running on a laptop. And so if, you know, whoever was running that laptop that day got hit by a bus, we would have lost that capability completely. But now we can run it in this cloud-enabled environment. The folks that were in CDC that were trying to run a handful of MPOX models to understand the network, some more elaborate network models to think about how we would actually mitigate some of those situations during the height of MPOX. They couldn't run those models on their laptops in an efficient way, so we ported it over to the Virtual Analyst Platform in the cloud-enabled environment. They ran it there as well, and so it enabled them to do things. Now, the hope here is that we might be able to actually allow, you know, either academic partners, state and local jurisdictions, or international partners to actually work on this environment as well. So it will allow us a handful of advances. Not only will it provide tools in a systematic way, but it'll allow people to be able to work on it in a similar way, like I'd mentioned before. And so I think that this is going to be, like I said, this is still in pilot format. We're trying to work it out and trying to make sure that it's valuable. But so far, it's been very exciting to develop this and going forward. I know, we have great hopes for this going forward. Now, how we are, the way I refer to the value proposition of the Center for Forecasting, Outbreak Analytics as well is that our mission is to provide an analytical insights during a public health emergency. Now, our 10x value proposition is, can we do that for the federal government? And I am confident we're going to be able to achieve that 10x value proposition because we've been doing it for the past year, 18 months or so on a consistent basis going forward. Now, the 100x value proposition is, can we provide analytical insights or capabilities to generate those analytical insights for state and local jurisdictions in some capacity? That's the aspirational goal, and that's what we're really shooting for, and that's really when we're going to be cooking with gas, because that's where as you all know, I don't need to convince you all that that's really where all the fundamental sort of action happens in public health in our federalism system. And so how we actually accomplish that is going to really require that the data modernization initiative, the public health data strategy succeeds, that we forge these relationships more effectively with you all at the state and local level, and that, quite honestly, that we work effectively with the private sector. We need to have the private sector capabilities more robustly represented in our capabilities for us to achieve this. I mean, we live in this world, you all live in the shadow of Amazon here, and so you don't have to be convinced of the importance of, Amazon, Apple, Google, Netflix, these trillion-dollar companies that have transformed our economy and our lives. The United States has led in the data revolution, but the data revolution has not seeped into the public health infrastructure, as you well know. But we need the private sector to actually be effective in this as well. That's why I'm super excited that we're here today to talk about how we can actually collaborate and partner with the private sector in accomplishing these goals. So we are trying to work more closely with the state and local jurisdictions in thinking about how we might place data scientists at the local level, how we might actually provide access to things like the shared analytical zone or the virtual analyst platform, and also cooperative agreements like this one. Very excited about this. We just put out a call for proposals, and we have been reviewing them recently to establish what we're referring to as the Outbreak Analytics and Disease Modeling Network. And what we're going to be doing is we're going to be funding up to 13 different performers to actually develop in 3 different buckets. The first bucket is innovation, where we're actually going to have people that are going to be coming up with new methodologies, testing out new data, and thinking about how to actually apply those. We're going to fund another bucket of performers that have to work with a health department. They have to work with a state or local jurisdiction to actually test out to see if that analytic or that new methodology or that new data is actually fit for purpose to actually make decisions bigger, faster, stronger in some way that is much more useful. And then we're funding a couple different people in the last bucket to actually spread the love, so that if we find something that's really successful, how do we actually replicate it in other jurisdictions and move it about? We're really excited about this. We're actually going to announce the awardees for this in the next handful of weeks. We're, like I said, about 13 performers. They're going to be somewhere between $3 to $6 million per performer for over 5 years. That rolls up to about a little over $250 million over the next little while. I'm very excited about this particular network. One, because it's going to advance our innovation in the developing new modeling approaches. 2, it's going to forge new capabilities at state and local jurisdictions in the direct performers that are working in this, and then also spreading that going forward. And then 3, over 40% of the proposals we received for this were that had a private sector component to it. So not only are we working more closely with the state and local jurisdictions through this network, we're also bringing in the private sector much more robustly through this as well. So we're accomplishing those two of the 3 major objectives in trying to attain our 100x value proposition. So I'm very excited about this going forward. I will stop right here where I started. I opened a conversation talking about severe weather and how Galveston was a major event, and how we had to think differently about data systems to keep Americans safe because of Galveston. This right here is a figure that I talk about a lot. This is numerical weather forecasting through time, and what this essentially is showing you is that we were pretty bad at weather forecasting back in the 50s and 60s. We don't fully appreciate how bad we were, but we were pretty bad at it. Now, I guarantee you, every one of you has a mobile device, and you check your weather probably multiple times a day, or at least multiple times a week, to understand how to modify your behavior. Now, and some of us perhaps may have wished that we would have paid more attention to that weather as we were coming here because of the heat. But, you know, it's like, you know, live and learn. But we're much better. We know how to intuitively use that information to modify our behavior and to make sure that we're moving forward. Where we are with disease forecasting and outbreak analytics, we're in the early stages. We're back not in the 50s and 60s where we were completely rubbish at doing numerical weather forecast. We're probably in the 70s, 80s or so, but we need to get much better. Now, the reason that I left the private sector, when Rochelle Walensky asked me to come and help set this up and to move this forward, the reason that I left the private sector was because I believe that we can keep this on a monotonic increase going forward. We can actually build these capabilities. We are at a transformative moment right now in the United States. The need is very clear. We've all seen it through the past outbreaks, COVID, Mpox, and now as we come into preparation for the fall respiratory season, we need data to keep our families and our communities safe from infectious disease situations. The technologies are there. Apple, Google, Netflix, they are there. We need to apply them appropriately. And we have the dollars, the incentives, and the leadership of people like you in this room to actually make it happen. This is why I'm so excited. This is why I came from the private sector here to actually do this. This is why I think that we can make a lasting difference and we can actually have an inflection point in public health generally going forward in using data as a superpower to keep our families safe. And so that's why I'm grateful to be here with you today. Thank you very much, and look forward to chatting with you throughout the day. Yeah, cheers.